next one. Okay, as a generalization, there's three primary postures: lordosis, kyphosis, and scoliosis. And again, normally they're a reflection of lifestyle, habits, training, money from things, injuries potentially. So lordosis, the first one, is, I'll show you the next slide. Is, well, we'll start with, you have a little diagram here. So lordosis, first of all, is this one here. Okay, that's when your lower spine, or your thoracic and lumbar spine, has become excessively curved. So what happens is here, is your glutes become tight, which is your bum becomes tight. Your abs become too long, or insufficiently long, and this causes your hips to tilt forward, which is not something you want. Then you maybe get issues with sciatica or any parts of your lower extremities, just purely because the nerves are bunched, and the two, well, they work as efficiently as they could do. So in the example of kyphosis, which is probably pretty prevalent here, is an example where you get your desk shoulders, it's called. You kind of roll forward, you sit at your desk, do your typing, and then your front becomes tight and your back becomes short. Now, one thing to bear in mind is with posture in general, is if one muscle becomes long, another muscle becomes short. So your body literally isn't capable, we're just walking capable systems. So to give you an example of that down here, if you look at lordosis, which is this example here, the back has become excessively tight. Obviously red here indicates tight, and blue indicates exceptions. So your back has become tight and your front has become loose, pulling you backwards, which is not something you want. Again, same the example of the hip tilt. Finally, scoliosis, which is the last one we have here. That's a less common one. It's when there's a lateral movement in your spine, which basically means that your spine has kind of been pulled sideways, which can cause all kinds of issues. To address any back pain issues or any pain issues you have in terms of the posture, you need to address the trouble or the culprit muscle. So you need to kind of identify which muscle is pulling you out of that optimal alignment, and then address it appropriately in terms of its length, its strength, its shortness, and its ability to retain its kind of tension. Cool, so that's pretty much done. So in a nutshell, really, when you kind of come out of alignment, you need to just find the muscle that is responsible, and then appropriately strengthen it. So, for example, say your abs are too weak, too long, and you kind of get this lordosis going on, where you're being pulled back. Then what you would need to do is do resistance training on your core, or at least on your abs, or your rectus abs, which is your front abs, to bring them into flux with your multifidus and spinal erectors, which will be the muscles on your back, conversely. So you may find the muscles on your back have become too short, too tight, and the idea is you might want to do some mobility training, so you go on the floor, stretching your back out. Again, there's a number of different things you can do to address it. Yeah. Cool, so kind of like a generic image, really. If you have a tight core, everything seems to function together well. You do get instances where one muscle has pulled you out, but as long as you train your muscles appropriately and you give yourself a good balance of all-round strength in terms of your core, then what happens is you're kind of forced into optimal alignment. So the thing to do is to consider core exercises or exercises that kind of address your weak areas really. And that, guys, is pretty much it. I know it's quite short. One thing we do offer, if it's something you're interested in, is posture assessments. They're £15 for a go. Assessments last 30 minutes, and we can kind of measure you out, bring some tools in, and kind of work out where you're short, where you're tight. So that was pretty much. Does anyone have any questions? I was kind of really hoping people would just fire some questions at me, and I could kind of answer the questions. So anybody got any issues, back pain or anything like that?
Right, very quick. When you have a hernia of the disc, once that's happened, can that be corrected?
You might not ever have the same kind of strength you had. Depends on the grading of the hernia. Normally what happens is if you've been in a contort position, so say that this example like where I'm also like desk shoulders, what happens is the upper section of your spine, or the C-section of your spine, which is the top section, has become overly flexed. So it's bent forward, obviously, kind of herniated, example I gave you. Now, the disc is being pushed forward. To rectify that, you need to strengthen up the muscles between your shoulder blades, so like it would be your rhomboids, for example. And that would kind of pull everything back outwards, sort of bring you more into optimal alignment. As long as you strengthen everything around it, it will recover. But these discs, they do wear out. And the general rule of thumb is this: is your muscles will come and go. Muscles are very pliable in that sense. You can train them up, they'll shrink down. You can train flexibility into them. But connective tissues, so things like cartilage, ligaments, tendons, they tend to be a little bit less active in the sense that we have control over them. They have a reduced blood flow, which means that they don't get as much oxygen, as much protein, and as much of the nutrients provided to them. And they're a little bit more permanent. So if the joint goes, then it tends to be a lot harder to rectify than it would say if you had a muscular issue. So you kind of can, the real thing to do is to strengthen the muscles up around the issue, around the joint. And then what happens is it becomes more efficient at dealing with the loading. And then, in theory, you get less trouble. And because the posture is more optimal, it means you have the right conditions for that healthy kind of joint gliding between vertebrae. So that's kind of the best answer I can sort of give to that one. Any questions, guys?
Can you have a combination of those posture issues? Can you have
Yeah, you can have loads. To be honest, those three were kind of a real generalisation of your posture. But yeah, there's to be honest, it's one of those things really. It's kind of immaterial. There's no real single classification. People have morphological or biomechanical issues all the time, which is just down to your lever lengths and down to your muscle lengths and down to your lifestyle. If you have a sedentary lifestyle, to some extent, even your physiology, muscle cell typing. So yeah, you can have a whole combination of them. But the best way is to just keep everything supple. So I mean, a lot of people will say, there's this kind of trend. Well, you should sit up at your desks and have your chair behind a neutral spine. But the truth is, it's quite immaterial. That won't really affect much. That might help you a little bit short term in terms of impingement, and in terms of just being in the right posture for blood flow. But once you stop doing that, those issues, those habitual issues which have caused the problem in the first time, they'll just set back in, and then you'll just continue to do what you were doing before. So what I think the best thing to do is to 2 modest 30-minute sessions twice a week in a gym, but training appropriately. So lengthening, strengthening the right muscles. Like flexibility and mobility training is what I prefer to call it, just to make sure everything works efficiently together. That's far more effective than hours upon hours of trying to actively force yourself into this good position. You see, the trouble is as soon as one muscle becomes long, your central nervous system will send impulses to your muscles to switch off muscle tensioning. So muscles, you said, there's a lot of stress on this muscle, you need to add a bit of length as a precaution to safeguard yourself against injury. So say, for example, you're sitting forward like this, and your nervous system is telling your back, a lot of tension on the back, so let's loosen the back off, and let's shorten up the front, because we don't need that excess slack on the front. Now if you do that, if you're exposed to those conditions long enough, you end up with longer muscles on your back and your front. You can be somewhat like 25-30% beyond, longer than it's meant to be, respectively. So the idea is you want to kind of avoid those conditions when you're kind of forcing yourself into bad posture. But normally it's like a habitual thing. A couple of hours in the gym will fix you to the point where when you go back into sitting awkwardly, causing those overstretched muscles to kind of set in, the gym will kind of fix that. Half an hour you put in the gym will be probably tens of hours sitting in posture. So it is a worthwhile investment. At the end of the day, we're only soft machines really, so it's good to kind of invest a little bit back into your body. So yeah, I think that kind of answers it really. But yeah, there are many different sort of issues.
So you strengthen the tight bit and flex.
Sort of, yeah, it's kind of like, yeah, pretty much. So I mean, like if you imagine, as one muscle becomes long, another becomes short. And the idea is you're trying to reduce the length of the long muscle, and they tend to become weak the longer they become. So you want to reduce the length.
How do you do that?
You do resistance training. So typically you would do something like hypertrophy training, which is normally what you would consider an intermediate rep range. So something like you select a weight you find challenging, and you would do 12 reps, followed by rest, and then another 12 reps. The idea is that will add shape and readiness to the muscle. Almost like the cell itself, which is very string-like in its appearance, becomes more taut and is more ready, if you like. And that kind of pulls things back into sort of place. And again, in terms of flexibility training, if a muscle is short, then you just expose yourself to the conditions where it's longer. So say, for example, you've got a short front, you just lay it over a ball, or off the edge of your bed, or whatever it might be, and, on a long enough time scale, you will eventually loosen out. So that's really the thing to think of is we are like cable systems, as we move about in our skeletons, So as one gets long, one gets short, we're constantly controlling our acceleration and deceleration. So yeah, that's the best way to think of it, really. Cool. Any other questions?
Yeah. Is there a connection between wearing high heels and the...
Definitely, yeah. You become... The Oh, so more so towards lordosis.
Yeah.
What would happen is the posterior chain, which is basically a fancy way of saying the muscles on your back become overly tight. So what happens is you're forced into a highly plantar flex position, which basically means your foot is kind of planted forward, obviously. The trouble with that is you get a short sole, a short calf. So basically, everything on your back, but not just your like down here. Everything on your back becomes short. So one affects another. To generate force, all the kinetic energy literally comes through the floor. Obviously, it's mirrored back and through my body, and it will follow a path where the force is being converted. And it's the same thing. If you're walking in a certain position, it has a knock-on effect with its neighbouring muscle, and in turn with the nerves, because nerves run in through the muscles. So yeah, high heels. Here's what would typically happen. Say for example, somebody wore high heels quite a lot. Then what would happen is if they ever needed to quickly dorsiflex their ankle, which means bring it back inwards, their risk of injury would be greater because the muscle is too conditioned to be in that lengthened position. Or too used to it, if that makes sense.
Yeah.
So wearing flat shoes.
Flats, flat shoes. It might sound silly, it's not even just a girl thing, wearing flats as a guy, if you have a little heel, you get a lot of sports trainers with big, thick heel, they can cause you to be plantar flexed, these sort of things, for example, they cause you to be plantar flexed, and your risk of injury would be higher that way. Cool. Any other questions, guys?
At what point do you worry about your back and neck and cracking noises? Like back
Actually, contrary to popular belief, cracking noises are quite healthy. It's a sign of synovial pressures being reduced in your bursa, or the capsules within joints, and it just means they're mobile. The thing is with joints is to keep them healthy, you need to make sure they never lock up. So it's a little bit like like an engine. You keep them greased and oiled. It's the same way with joints. A little bit of activity. It kind of like, in the same way that a river kind of carves its path through the landscape, your joints kind of carve their path against one another. So it's kind of like this gliding motion that keeps your joints supple and lubricated. So if say, God forbid, somebody ended up in a coma and was bedbound for, say, a month or something, the joints will tend to want to seize, and it's this kind of movement that kind of keeps them healthy and lubricated. But no, cracking out your joints, as long as you're doing it within, safe parameters, of course, then it's completely healthy and just keeps you nice and loose.
Define safe parameters.
Well, I'll be honest, you don't ever want to go into a state of hyperflexion, which is when you go beyond the joint's intended, exactly. So you don't want to go beyond 90 degrees at your elbow, say, for example. So yeah, as long as you go within its healthy range, then that's fine. Cool. Any questions, guys? Yeah, no worries. Okay, so I think we'll wrap up. It's quite short and brief, really, but if you have any questions, then just hang around and, yeah. Cool. Cheers, guys.
Thank you very much.
Thank you very much. Oh, guys, sorry, can I just get you all to sign your